Steve
Yeah.
Gurney.
I have to plug in having juice.
Oh, me too. Would you hand me my charger? Why am I not here? Oh, Shelley, would you do
Oh,
something
do that.
over there? F1 or 2, maybe F2 up top. Yeah, that's F1. There you go. Okay. Did anything happen? Is he talking? What's going on? What time is it? Who are we? Where are we?
Okay, welcome back. And I'm excited because this was going to be our presentation at the end of the day, but now we've moved it forward. And so I'm going to introduce two of our great board members, William Kincaid, Bill Kincaid, and Aram Abbasi, both in the metropolitan area, DMV, but Aram's actually closer to Baltimore, but they have spearheaded what we started 2 years ago, the Village Impact Project, and they took the baton and they're running with it. And so I'm going to let them we'll have a great hour to learn about our data project and have some questions and answers at the end. So feel free to, I don't know, Aram, are you going to monitor the chat or whatever?
Yeah, so we can start, and then and between Bill and I, we can monitor the chat as well.
Well, I'm here, so let me know. Okay,
Mhm.
so take it away. Thank you.
All right, thank you so much, Barbara, and welcome everyone to our annual Village gathering and celebrating the 20 strong years to the Village movement. We're gathered here today because we care about our communities, the people we serve, and because we have seen the impact of villages firsthand. With that said, we at the Village to Village Network, as Barbara mentioned, have embarked on a journey to understand and share the impact of villages on a broader scale to attract stakeholders that can help expand and fund this movement. Hence the start of the Village Impact Project, which we will talk about today. Go to the next slide. Yeah, thank you. So currently, we've all seen, like I said, we've all seen the impact of villages firsthand. But when we talk about queries and what we get, what we have in terms of the data from villages, we at the national level currently do not have an accurate count on the basic information for villages. So in terms of how many villages, like how many members villages serve, the demographic, the volunteers, scope of services, all of this information that's important for stakeholders to understand and fund this movement. Bill, next slide. Yes, thank you. So there's been a growing emphasis, there's been an increased emphasis on home and community-based support, social determinant of health, which has opened new opportunities of funding for villages, which Bill will discuss later today. Briefly later in the presentation. We really need to make the case for villages and the fact that they're effective and the impact that they have on the lives of older adults. And for that, we need data to prove. Bill, next slide. So the problem, what we've encountered, what we've seen is that, oh, sorry. Can you guys hear me clearly now?
Yes.
Okay, sorry about that. Okay. So the problem we have encountered is how do we collect this information on an ongoing basis? And we've struggled with this for sure. We understand our villages are already swamped with, serving their members and then requesting, on an ongoing basis more data, data from them. So and not burdening the administration, the village administration. So, so what we've done, and the other problem that we encounter is not all the villages are using the same terms, slash taxonomy to tag of services that they provide. And there are other cumbersome ways, and there's so many other ways that villages are collecting this information as well. The next slide. So what we came up with is our approach, which we thought the most efficient way we could collect this data is through the data management systems that our villages currently utilize. And there are two main vendors. Next slide, sorry. Thank you. So there are currently two main vendors that our villages use, Helpful Village and Run My Village, which you saw a demo earlier. And currently about 65 to 70% of villages are using these systems to gather information on members, services. And like Dan mentioned earlier during his presentation, the information that you guys are tagging can be utilized locally for your, for purposes of grants, funding for, through your states or any other funding. So that's great information that you guys can utilize at the local level, but at the national level, there's an opportunity as well for us to have that information. We can make that information available to stakeholders to get that national attention that our villages desperately need.
And one of the great advantages that really made this whole process of aggregating data possible is some work that was done over at Capitol Hill Village in the district. This data actually was presented last year by Judy Berman, Scott Price, and Manuel Acevedo. And what they did was come up with a taxonomy that allowed the system to roll up some of these categories in more usable format. Villages labeled their services differently, and an example is mow a lawn, light landscaping might be the way those services would be recorded. But there really isn't much difference between those two. So what the folks at Capitol Hill did was try to find a way of lumping those kinds of services under a similar heading so that we could roll this data up and collect it from multiple sources. And the goals of the taxonomy project were to develop a language that could combine the operational data and basically use that information in a couple of different ways. One, documenting the collective impact of what villages do, and also see if we could attract investments and funders, and also deal with research in the future, because I think long-term, it's going to be very important for the village movement to show not only what our outputs are, that is how many visits we make and what kind of visits we make, but what are the outcomes? What effect is that having on our members? Are they living longer? Are they happier? Are they actually able to stay in their living situation longer because they're a member of a village? Those are important questions for policymakers long-term, and they're important not only at each individual level, but also on a regional level as well. There'll be a presentation on Thursday, actually, about leveraging resources. And Mary Jane Atwater and some of the other board members and village members are going to look at the partnership between AAA and the villages. We've been able to use that very effectively here in the district because the district actually is the AAA funder, and they actually provide a lot of resources for our villages here in the DC area. So aggregating not only at a local, but a regional level has some great impact long-term. So there's some lessons here, I think, for all of us going forward. So getting back to the taxonomy, if we look at the kind of language that might be used, we could say, well, we transport people to medical appointments. But a better description of what's going on is to say we had 24 volunteers who transported 39 village members to medical appointments. Even better from a regional and national standpoint is aggregating that data together, saying we had 89 volunteers and 154 village members were transported. So again, it aggregates the data in ways that would be meaningful to a funder and to a policymaker. These are the categories as of last year. I think they've been fine-tuned a bit, but it gives you an idea of how this taxonomy process works and how the village services are lumped. Wellness support is one format. Independent support is another. House and home support. And again, there's a bunch of subcategories under that. Professional services, transportation, and this is one of the most popular processes is the transportation. Diversity and equity inclusion, and also volunteer engagement. Those are some of the categories that can be rolled up into these larger categories and used to measure what we're doing over time. Now, for the Village Impact Project, what we tried to do was get members that are using the Helpful Village platform, and there were 62 that are using this taxonomy. We were able to get 31 folks to agree to be in this initial run, which was kind of a proof of concept. Can we aggregate this data over multiple sites, literally from coast to coast, and come up with some numbers that are useful for the villages? And in fact, we were able to do that. And a shout out to all the folks that were able to help us with this, and also to Helpful Village, who was very instrumental in getting this done. So the first proof of concept run was done actually in early October. It included a one-year period from October 2021 to September 2022. So the results, literally the ink is still drying on the results. But what we did was aggregate de-identified data. That is, this is data that isn't trackable back to any individual village member, but it's in the village database for their village site. So we looked at the total number of members, all categories, total number of volunteers, the total number of services, the types of services provided, and also the number of hours, the volunteer hours that were used in the report. So it turns out that of the over the time period that we're discussing here, the one-year period, there was actually a 10% increase in the number of members. And I think that's a good sign that basically it shows that our village membership is growing over time. And the other thing that we noted was that transportation was one of the most important services that was provided. About 47% of all the services provided were in fact transportation. Wellness support was 90% of the services that were reported. That's again in the wellness category. And 62% of those wellness support visits were for individual isolation interventions. And again, remember, this was during the time period of the pandemic. Villages were certainly sensitized to individuals that were isolated, alone, couldn't get out. And those kinds of calls and services were extremely helpful in carrying the villages through that time. So again, 10% increase in membership over the one-year period. Transportation, almost half the visits. Wellness support, 19% of the services, and a lot of that was for individual isolation services. So again, I think the village is stepping up and meeting its needs for the community that they're serving. Now, the next steps we plan to take are to do a webinar in late October with the villages that were part of this initial run to kind of give them the data. There's an 11-page report that we have that has a lot of detail that we won't be showing today, but we want to share that with the villages. Look at how this is likely to impact their services going forward, and also take a look at how we might recruit additional partnerships, additional participants for the data subcommittee. So we'd like to reassemble that. We currently have a subcommittee of the development committee that is looking at these data issues, and we want to put those folks back to work. I know that Carol Paquette last year had a group she was meeting with ad hoc, which was 20 or 30 folks, and we hope to get those folded back into the committee as well as we move forward. This whole data piece is really built on the expertise of a lot of local villages who have individuals that have handled large databases before or crunch numbers to come up with reports. And we want to be able to use those not only for individual villages, but also on a regional basis to be able to entice funders to get involved with the village movement. We're also, again, looking to look at to see if we can get more participation in the VIP. Currently, Helpful Village has been able to do these aggregate reports, and we're going to be working with the folks at Run My Village as well to see if we can aggregate that information as well. Those two sites account for 65 to 70% of all of the villages. So we'll be able to get a pretty sizable chunk of what village output is. And we hope to be able to use that going forward to stimulate more work on what are the outcomes of village life. And in that regard, we're working with the folks at Rutgers and the RAND Corporation to apply for a grant from the Patient-Centered Outcome Research Institution. This is actually the largest funder of outcome research in the United States. So they look at comparative effectiveness and comparative effective analysis, trying to look at what is the best way to do something. And they tend to fund mostly medical research. That is this form of diabetes control better than that type of diabetes control? The folks at Rutgers and the Village to Village Network asked for an opinion on whether they would accept a full grant application from the Village Network and from Rutgers and Pecori, looking at villages rather than as a medical intervention, rather than as a medical treatment. And they said yes, they would entertain that. So we're currently working on a grant. What we hope to do during the time period of that grant, which will cover about 1.5 years, hold some focus groups, try to find out how villages feel about, and villagers feel about being studied. Because if we're really going to get to outcomes, that is the effect of village life on our members, the members are going to need to be involved in that research process. And many of these research projects in the early years were done by people coming in from the outside, gathering some data. They gather the data, they disappear, and the people that were studied really aren't included in the outcome, weren't included in the planning. And many communities, I think, felt that they were abused because they weren't involved in the process. So what we want to do is see if we can develop some interest in this process, some understanding about the complexities of this kind of research, and get our village members and the villages involved in designing these research studies. Do the research, do the exercise classes that many villages offer, do those improve outcome? Do they make people healthier? Is their heart condition healthier? Are they able to walk longer? What are the benefits of those kinds of programs? Again, looking at those programs inside of the village system. So we hope over time, this kind of research will help us not only get funding, but also document what we're doing so that policy makers in the country can start to take a look at the village movement and really fund them on an ongoing basis. There's some talk about the Medicare Advantage plans. I don't know if you all have been tracking how the Advantage plans are making inroads into the Medicare population, but next year, 50% of Medicare eligible individuals will be in an Advantage plan. And the Advantage plans are a great opportunity because they can supply services that aren't necessarily mandated by Medicare. So services like belonging to a village might be an extremely useful, a useful intervention for them, because it would increase the health of the individuals and hopefully reduce the medical costs long term. So I think there are a lot of ways to look at this kind of research over time and develop the systems that we need to capture this information. So anyone who's eligible or interested rather in getting involved in this data process, please let us know. Send us an email. We'll stick you on the list and make sure that you're involved in this process going forward. But Aram and I are very excited about the potential for doing this kind of work and making sure that the funding that villages need long term are actually there. So it's developing these new partnerships using data that I think is going to be extremely helpful. So any questions or comments?
Oh yeah, you got tons. Aram, do you want to go through them, or do you want me to read them off?
Yes, let me, I know there were a few of those. There was a question about villages that are not using the two systems, how if we would include those. I think the answer would be yes, we would certainly like to work with those villages as well.
That is a tough, thorny question, because one of the nice things about using this approach is that the information that villages use on their day-to-day activities is already in the system. So instead of having to send a questionnaire or a form that you need to fill out, literally we can punch a button and the data comes out. So it's very cost-effective in terms of villages' time. The villages that are using other systems, we're going to have to come up with ways of assembling that data and porting it from whatever they're using, whether it's an Excel spreadsheet or the back of an envelope, or whatever they're using, depending on how sophisticated the data system is, to getting that information into the database. So we're a long way away from having 100% participation, but I think if we can get, what we have now is basically 10%, and that 10% number is a good representative sample of what villages are doing. So it does give us some hints, but I think the more inclusive we can get, the better off we're going to be. And again, we'll be looking at reaching out to those individuals that are using other systems to figure out how we can do this. It may be important, I think, in the long run, to cone this, the request down to those pieces that are the most useful for us and the most useful for the villages on a regional basis as well. So we'll be looking at that, and that's one of the topics I think we're going to be discussing at the subcommittee to figure out what those key elements are.
I know that there's a bunch of people that have inquired about this bill in Aram. I know that my former village, Mount Vernon Home, uses what they call it's through NV Ride. So the DMV has it as in Maryland and Virginia, but the program is called Ride Scheduler.
Mm-hmm.
So it's primarily all, and they do run reports. They're very actually great reports, and I think it would be very easy to aggregate some of that information over to what you're looking for.
Yeah, and I
And
think
likewise, I know that there are villages out there, and I know it's in the chat, of villages that do have pretty good systems and reporting systems. So we'd love to hear from you. Aram, they asked for your email address again in the chat. But I'm trying to see what else we have as far as some of the questions. I'm going to go back to a couple of the questions. I think, Margie, your question about only Helpful Village users, right now they are working with Helpful Village, and they've also been in conversations with Run My Village. So stay tuned. This is very new and just getting started. One other question is, what are you going to use as a control group to compare village members to the general population not taking part of in villages? This is from Sarah Sheets. Have you gotten that far to look at?
Yeah, I think as we move forward to designing these research interventions, that's going to be a key question, because there always has to be an experimental and a control group. That's kind of the gold standard for research. And that's why I think it's going to be important to involve the villages and the villagers in these kinds of protocols. It's going to be difficult to do a broad spectrum, one-time study looking at what is the overall brain function of villagers and what is the overall physical activity of villagers. These are going to be smaller individual studies, and well, again, that issue of what is the control group, what is the experimental group is going to be a key part of that. And again, that's where having the researchers talk with our villagers so that the villagers understand the research lingo and can get on board with these studies, that's going to really be key. So it's getting us to the point where we can converse effectively with the researchers that will answer some of those design questions.
Bill, I just wanted to add a couple of points on some of these questions. To go back to the question about why Helpful Village, we started with Helpful Village because they were involved in the development of the taxonomy, and many of their villages have implemented the taxonomy in their system. As Barbara and Bill mentioned, we have had some preliminary conversations with Run My Village, and we'll be working with them to get the taxonomy implemented in their systems as well. So, we have a path forward to include the Run My Village users. And I think on the PCORI project, we won't actually, the grant application we're doing right now is not actually to propose research projects. It is to get the infrastructure together and get a mechanism and a process and a way to recruit members to participate in research projects that will be defined later.
It's really about beginning a dialogue with the research community.
Right.
So there's a couple more things in the chat. Aram, did you want to go through them, or do you want me to go through them?
A number of folks have asked for taxonomy, copy of the taxonomy, so we will be sending that out, or can you send that out if you can, Barbara?
I'm sorry, you're I
Sorry.
barely hear you, hon.
Sorry.
Oh,
There's
there
a
you go.
person that asked for a copy of the taxonomy for volunteer services. If we could also send that out, if you can email us, and we'll make sure that we send it out to you guys.
That's great.
I think Travis put in the chat that the full taxonomy briefing from 2021 NVG is on the VTV website, so people can go right there and look at last year's conference proceedings and get the full briefing on the taxonomy project.
True.
The folks at Capitol Hill are actually working on another variety of this. Instead of looking at just the services, they're starting to look at the programs that are offered by villages. and trying to classify them. How many of them are exercise type? How many of them are health related, disease related? And that I think will be extremely helpful for rolling up the data from villages on the kinds of programs that they're doing. And again, looking at the impact of the programs, I think is going to be important as well going forward.
And I think there was a question about the webinar that we're going to be doing on the report. We're doing the webinar with the participating villages for openers because they are the people that authorized us to access their data. So we want to show them the results of the report. And then I think coming out of that webinar, we will be making plans for perhaps engaging more villages or what the next steps are in terms of sharing this data. It's very important that everybody recognizes that in order for VTV to have access to this data, we have to have the express permission of the village to get their data. So that's part of why we can't just say, here's the report and give it out to everybody, because we have to respect the ownership rights to the data of the individual villages that are participating.
Lisa has a question, guys.
Carol, do you have a date on that, when you're going to be releasing that?
I can't say that we're going to be releasing that report. That's something that we will have to discuss with the villages if they're comfortable in doing that.
Okay, because I'm in Sausalito and we're in villages, so I was just wondering if there is a date where that would be available for the villages to actually see some of the raw data.
Are you one of the participants? I'm sorry, I don't know if your village is one of the participating villages or not.
I'm in 2 villages that are participating.
Yeah, we don't have a date. Bill, I think it's right. We haven't yet set a date for that webinar. Is that correct?
I need to check
Yeah,
this.
it's coming. Yeah, it's coming.
It'll
We
probably
don't
be
have a-
before the end of this month. And we'll
Okay.
send that report out to you before the meeting.
Yes.
Okay, thank you.
There was a question about the taxonomy, not, I guess, not understanding the taxonomy, or is there still time for input in that, or is that a done deal?
I think that's really a question for Capitol Hill because they're taking the lead on that activity. I don't know if Judy Berman or Scott might be on this call.
Judy and Scott have done, yeoman's work on this.
No, neither are on the call right now. So there was some chatter also about the Medicare Advantage programs, if you wanted to expand on that a little bit. Don't know.
Well, the Advantage programs exist by law, and what Congress decided was that they would give managed care plans an additional amount of money over and above what the average Medicare patient would cost. They get about 20% more per member on average for every for the members that join their managed care plan. Those plans have a wide latitude in providing services. I worked for United Healthcare for a while as a Medicaid managed care medical director and did some work with the Medicare plan as well. And one of the things that the managed care plans are concerned with is lowering costs. So they want people to be healthier, and they also want to lower costs. So if they can invest in services that would prevent higher cost services from being required, they make money. So they have provided silver sneakers in some of their plans. They provide extra dentistry, some other services as well. But it may be that belonging to a village would be helpful. If you went into a hospital and had a hip replaced and had a complication and then ended up going home, it might be useful to have a village look in on you to see what your needs might be while you're recuperating from your hip surgery. Or if you break your ankle, you know, the managed care plan will pay for physical therapy, but they're not going to walk your dog. So that's a service that might be offered by a village. So the managed care plans may see that as a useful partnership going forward. Now, again, we need to collect some information about what is the impact of the services we offer before we can flirt with the managed care plans. But I think that potential is certainly out there. And looking at those going forward, I think is a useful avenue for us for funding. So if you have folks in your village that are used to using large databases, used to crunching numbers, are familiar with manipulating data, please funnel them our way, because I think they'd be extremely useful as we think through some of these very complicated problems going forward.
There are a few questions, folks asking if they can still be part of the data collection.
Yeah, we will probably do another run in several months using again Helpful Village, because they're on board and have the report writing capability. And again, I think looking at these over time, it's going to be extremely helpful. As I mentioned, there's been about a 10% increase in the number of members overall over this 1 year period of time. And it will be interesting to follow that forward. Is that just a rebound from effects of the pandemic, or is the village really growing? Those are some questions that we can answer going forward by looking at this information on a 6 month, one year basis.
There were also some comments about additional data elements. Since this was just a proof of concept, we chose just a few, very simple data elements to look at. And as we're moving forward, we will be looking at expanding the list of data that we want to look at. But well, first of all, we were trying to start small, and we will build incrementally as we move along. So join us.
Other questions? Anything else in the chat that we need to look at? If we haven't answered your chat question, shout out.
Well, one of the things that we most certainly, and I think you guys will agree, David Feldheim said, if the outcomes of the pilot program are aggravated and not identified, why not open the webinar to all villages? You know what, if we host a webinar, it's open to any of the villages. It's just right now a very narrow, and if I think the people who are, Carol and Bill and Aram, just starting out, this committee is very small, but we welcome anybody to jump on and listen to what we're doing. And so we're not trying to narrow, and say only select few can join. Come and listen to what the conversations are and be a part of it. Rich.
Parkland Village was asked by Helpful Village, I don't know, much earlier this year, to give them authorization just for us so they can see what kinds of services we use, not how many and the kinds of numbers that you're talking about. So I guess we're not on that list. So I'm not sure that we're full participants, or if there are two levels of authorization. Are they first going to just check the number, the kinds of services we give, and then ask for the data? Like how many services are being provided, and we just started providing services a couple of months ago. So where is that at?
Well, I suspect Capitol Hill is always going through and updating the taxonomy to make sure that they're capturing the language that each individual village is using to describe the services that they're offering. So I think that may well be part of their kind of refinement process for making sure that these larger categories are lumped appropriately in the systems. And they may also be looking at did they ask for program information or just the service information?
I think they just asked for the kinds of services, and,
Services,
you know,
okay.
as
Yeah, they're
part of the
probably- yeah,
idea
they're
of making
probably-
sure that.
Yeah, they're probably updating that. And again, one of the things as we move from Helpful Village over to Run My Village, we'll have to make sure that the same eyes are categorizing these services so that the roll-ups that give us these larger categories are in fact accurate and complete and do move from village to village and capture the information correctly. So, you know, it's important to make sure that your data is accurate and verifiable and reliable over time. And that's what we hope to be able to do with this process. It's an iterative thing. You build on what you know.
This is Betty Ann from the Pasadena Village. I think you have to be careful when you're collecting data, and maybe you're doing this, I couldn't read it fast enough, that, you know, our village, I wouldn't say is focused on services, it's more focused on community. And so you have to be careful that you're capturing the real value to village members, for example, of being part of a memoir group or different other kinds of things.
The villages differ widely from place to place. I first belonged to a village here in Foggy Bottom, but as I get to know not only the other villages in our area, but villages across the country, they fill the needs of their members where they are. So they're very, very local, and needs vary. And I think the approach that different villages are taking, we can all learn from those various approaches and take the best practices and use them in our own village. And you're right. I think that, you know, you have to make sure that the data is really capturing what is going on. But this process is not about standardizing what villages do. I think villages should be creative and do whatever works for their community. But if we're going to try to influence policymakers and funders at a local and regional and national level, we need to have some of this quantitative data that can help to describe what we're doing. And the research outcomes are important as well, but I don't think we're at the research end yet, although there are a number of villages that are already involved with universities doing studies on various aspects of the programming that they offer.
I'm not sure how to speak, but I really appreciate this results or outcome emphasis. But I also want to agree with Betty Ann. At Chicago Hyde Park Village, socialization is a key part of our mission. So in everything we do, and I think as I've heard people talk about services, we make sure that there's socialization going on and also the programs. Now, that might be a little harder to quantify, but I hope that you don't just dismiss this emphasis on socialization and forming community as being local. I think that's an overarching need for many older people who are isolated and lonely.
And I think that is an important feature, I think, of what villages do. And the issue, I think, is that a service or is that a program? And you know, it's probably some of both. What we do here in Foggy Bottom is we have what we call cluster focus groups that meet. And one is just we go to Bread and Chocolate, which is a local bakery, and talk about politics or baseball or whatever. So again, it's socialization, but it's also one of the programs that we offer. So I think you're right. it's engagement and involvement in the world around you that is part of what villages are all about.
Lisa has her hand up.
I just want to chime in on that too. I think it comes back again to the importance of the data. It's kind of a chicken or the egg, because when you have those events, you know, the programs, Helpful Village allows you to register participants. So you're starting to track how many people are, you know, learning about advanced directives, how many people are going to your coffees and things like that, to the extent that they register. And that's going to be great data for storytelling, because that's kind of how you translate your data. And I put in the chat, I had to go away. You might have mentioned already, but I hope we don't lose perspective and just focus on our members, because we provide a huge benefit to our volunteers. Most of our volunteers are older adults, and to the extent that they're able to use their skills and socialize and put together the book clubs, the rummage sales and everything else, I mean, that is huge. And you see the health benefits to that as well. So I think the data approach and then taking those baby steps and going forward is great. So kudos that you're doing this.
We do have a question in the, thank you, Lisa, in the chat about when you might be looking for volunteer villages from Run My Village. If you're compiling a list or, you know, taking them as we move forward with this project.
Well, I think there's two approaches to that. One is to try to get a report from Run My Village. Another is to try to find a report that you can generate, that the Run My villages can generate, that could be easily aggregated. So there's two different pathways here. And again, we're talking with the folks at Run My Village about what the best approach is for that. So we don't have an answer to that yet, but I think that's the challenge that we face. And again, using the database that each individual village is using and gathering this data is another approach. That's going to be time intensive, and I think we have to weigh that time intensiveness with what the benefit is to the regional or to the national organizations. But lumping this data on a regional basis can be very effective. It's one of the things that we did here in DC, and it really helped the district get district villages get funding from the District of Columbia.
Lisa, did you have another question? Oh, okay, no problem. There was one other thing in the chat and I wanted to bring it up. Oh, Jacqueline Jones, and it's something I don't know as far as, and we talked about a little bit with the volunteers and the outcomes with volunteers, but the intergenerational aspect of, you know, what villages are doing. And I just wanted to put a touch point on that for you.
Yeah, I think the intergenerational thrust of villages is extremely important, and getting younger people involved. Most of our volunteers tend to be younger, and so that's one of the ways that we're supporting the intergenerational and intergenerational communication. But I think those pieces are extremely important for village life. And if you know, we're going forward, I would hope people would look at ways that develop best practices so we can all get involved in that.
Any last thoughts? There's great stuff in the chat room. Thank you so much. You know, between the—
There's one more question at the end.
Oh, can you send the format requirements for the file report you're currently collecting? You mean that one?
You mean like the questions we are collecting? We can send those out. Again, those, is that, Laura, is that the question you're asking?
Laura, what is that the question you're asking? Can you just unmute and ask?
Yeah, well, you mentioned that in order to have people participate who use Run My Village, they would have to be able to produce a report that provided the same types of information, like in the same way. So it would be helpful to know what exactly that is, so that
It's
to
okay.
try to mimic it.
Take your time. It's okay. No, it's fine. It's fine.
Okay.
Any comments on that?
Well, I think that is important. And again, that's one of the things that we're going to be looking at going forward. What are the critical elements that we want to collect over time to measure progress in villages?
Yeah, and initially, I think Laura, what you're asking is, so we chose those villages that have adopted the taxonomy project. So, but if you're asking like the questions we asked specifically, the elements that we asked for, we can share those with you.
Okay, yeah, that would be great.
Sanja, did you have a question? I know I saw your hand raised. Yeah.
Sonia.
Yeah. This is Sonia in Clayton Valley Village. I did have my hand up. I'm on the West Coast, so most of California has gone on the theory that services were important, but community was even more so. And in our village, we have found that. And again, I'm also applauding the comment about the volunteers, how important they are. It's a combination. We're all volunteer village, but providing programs and things for people for socialization has been critically important to us. So I wanted to say that, and all of this is very interesting information. So it's just, I'm just applauding what we are all doing and continuing to do it. Thank you.
Well, I'm interested in how people are describing the interactions that people have with their fellow members. Community, society, we call it affinity groups. There's a number of ways, I think, to look at that. But you're right, that's part of what the village life is. And one of the reasons I think that the pandemic was so offensive to people that were in villages, because we couldn't get out and do those things that we wanted to do. And I think that as we start to rebound from that, it's a good time to look at not only the processes we're using to do that interaction, but how engaged our members are going forward.
Terrific. Well, thank you all. I think this has been, enlightening, and I look forward to the next steps and engaging more villages and trying to expand. It benefits all of us, and it's a value not only to the network, but to individual villages who, anyway, so we are at a point where we're going to take a break and reconvene a little bit early, 5 minutes to 3. We'll take a break. We have 3 breakout sessions coming out. One is the successful village launch, individual donor fundraising, and then the last one is governance and succession. And so we will be back if you just want to go and take a quick break, stretch your legs, do a couple exercises, around the house, whatever.
Yeah.
We'll see you in a few.
And Barbara, I've opened those 3 rooms.
Okay.
So folks can move over there during their break. And then for those folks that had difficulty getting in the breakout rooms the last time, the drill. If you just hang out here and tell me what room you want to go into, I can move you into those. And then I'm also going to go to those rooms, and I'm going to make, if the leaders can go into those rooms, I'll make sure that I can set it up so you can record to your computer.
Yep.
Excuse me, I may have missed how to get into the rooms. Could you?
Okay,
explain
well,
again?
on most people's screens, you should see a little thing down at the bottom that says breakout rooms.
Oh, yes, I do.
And then you just select which one you want to go to, and it's as easy as that.
Thank you.
There are 3 breakout rooms of 4.
Excuse me, why did you list 3 different sessions than the ones on my sheet?
Right, yeah.
Mine says,
That was a mistake.
okay,
Yep, it's emergency weather planning,
Right.
strategic planning, and little village that could. Those are the 3 sessions. You'll
Thank
see them in the
you.
breakout panel.
Sorry, Jane, I was reading off the wrong script. So,
And Barbara, a question for me. When we go to the exhibit hall, I click on and I'm in the exhibit hall and I see the different exhibitors, but I don't see a way to engage with them.
they're
No.
not, there's no interaction this year. They just
Okay.
are putting information out
Okay, that's
there.
fine.
Each of our sponsors are having individual webinars, which they will be touting themselves. And so it's just a look-see, contact information, and
Okay.
referral source.
Great, thank you.
You're welcome.
Steve Gurney,
Yep.
Carol Hess. I don't have any choices at the bottom of my screen.
And
All
Steve,
I have is the word leave.
and
Okay,
Steve,
well,
all
we-
I've got is more. and-
okay, well, don't worry. Okay, so the first person that needs to go is Carol Hess. And which one?
that's because they have their chat open.
Yeah,
Oh,
Carol,
good.
which one do you
Thank
want to go
you.
to?
The little village.
Little Village? Okay, here you go.
Thanks.
All
And
right.
if-
Eddie, you have your hand up.
Yeah, Steve, did I hear you say that people in the different breakout groups will be able to record onto their computers?
Well, the leader, we just need to give the leader permission.
Okay,
Or somebody permission. Yeah.
okay.
We also have Darcy Levy has a question.
Yeah, Darcy.
Hi, once again, when I select the group, I don't know how to add myself to it.
Okay, which one do you want to go to?
Strategic planning.
Okay, there you go.
And I'm at more. And they said that I need to close my chat, but I'm having a hard time doing that.
Okay, what's your name?
Martha Lamb, M. Lamb.
But if you go to more, click on the more, and then you'll see a box open up. It says join breakout room.
Which
Gotcha.
one do you want to go to, Lamb?
I can't see the 3, so I don't know.
Oh,
what-
emergency weather, strategic planning, or the little village that could?
What's the last one, please?
Little village that could?
All right, so you're gonna go into the little village that could, so you
Oh,
can-
gosh, decisions. I'll
Please.
take the first
Yeah.
one.
Emergency weather.
Remember, they.
Yeah.
All right.
Thank you.
So they asked for you specifically to do it.
Okay. If anybody else
Okay.
is having difficulty
gonna
getting
go
to a room,
into,
just let me know.
Who is more
Steve,
needy?
Nancy Nordquist.
Norquist?
Yes, Nordquist.
Maybe I'll go in.
Okay, which one?
Strategic planning, please.
Okay, there you go.
Okay.
Steve,
Yep,
Patricia Allen. I would like Little
Yeah,
Village.
I'm gonna also, okay.
okay, there you
Thanks.
go.
Thank you.
And do you know if the AARP volunteer, maximizing volunteer engagement, do you know if that was changed to a different time at 9:30?
Yeah, I'm not sure because she was sick, so I don't know if they've rescheduled her yet.
Yeah, our AARP gal canceled early this morning on us. She's sick.
Oh, okay.
So it's going to be rescheduled at a different time.
Gotcha. Okay, so is the Village Basics Workshop for Volunteer Recruitment, is that the same one they did this morning at 8:15?
That's what they,
Village.
that's already happened. Yeah.
Yeah, that was this morning at a breakout.
Okay, I was there. Okay, perfect. Then that's the same one. Okay, so
Okay.
there isn't anything right now for volunteering. Am I getting that right?
No, not on the volunteer aspect, right?
Perfect. Thank you so much.
Okay.
Can you add Sonia Wilkin to strategic planning, please?
Okay.
Thank you.
Let's see. Am I spelling your name? What's your last name?
Wilkin.
Ah, there we go. Was spelling Sonia wrong. Okay, strategic planning. Okay, there we go. And hey, Barbara,
Yeah,
if you want to jump in the 3 rooms, just make sure that the leader can.
yeah, I know. Travis is going into the little village that could. I'll go into the other 2 to make sure that they.
Okay, yeah, it's pretty easy. You just.
Yeah, I'll just do it. Yeah,
Okay.
I got it.
Well, you can give them permission too.
Yep, I'm leaving now. I'm going over. to
Oh,
my
gotcha, gotcha. All right, so if you can hear my voice and you're not in one of the breakout rooms and you'd like to be, just let me know. And if you can't do it yourself by clicking on the breakout rooms button, just let me know, shout out your name and where you want to go, and I will get you in there. Okay, Linda, I will move you to the Linda Rockwell. Oh, she's already there. All right. So if you're listening to me, and if you can hear me and you would like to be in one of the 3 breakouts, just let me know and I will move you over. And I believe those sessions start right now.